All right. Hello, everyone. I hope you guys are having a great Thursday evening. My name is Garrett McLaughlin. Good crew signed up for this. A lot of people that I know. So glad to have you on here. Tonight, I want to cover post run. Let me fix that light. Post injury. Return to run considerations. Sorry, I don't want to get that light shining in your eyes there the whole time. But again, awesome topic. I think one very overlooked area or an area that a lot of runners are just going about incorrectly that leaves people just consistently in this pattern of pain, of injury, of running, of pain, of injury, of running, and it kind of goes on and on. So hopefully we can clarify that a little bit today and provide you some guidance to take and move on with your running journey. So as you guys know, those of you that joined me before, I like to look through the research to make sure that I'm not just throwing out my recommendations. These are things that I'm pulling from various research studies. So different return to run programs. Chris Johnson, there's one through Ohio State, things like Medical Center or something like that. A couple other ones based on stress fractures, hip arthroscopy, sprinting, ACL injuries. So I'd like to really condense all that information together to hopefully present some that will fit distance running as much as possible. And I think this will provide a really good framework for you guys to use moving forward. So focus of this presentation today, we'll talk about first the key information to get from your medical provider. This is the most important place to start. Hold on, I'm going to actually clear this off my screen just in case you guys can see any panels. There we go. Key information to get from your medical provider, understanding the rehab process. And then while you're going through that process, what are different strategies you can use to maintain fitness? How to establish phases with specific checkpoints. This is one of the most important things in the return to run process to facilitate a safe and effective recovery. And then outlining a structured and progressive return to run program, right? What does that program actually look like in terms of run, walk intervals, steady running? How do you progress and build that over time? And we'll talk about which is the most important thing, key principles to guide the process. Huge on principles. I think we need those as the foundation of our training. A lot of times we don't have principles. We make random decisions that aren't based on research and fact. So understanding those principles and using those to guide the process. And then we'll dive into a quick Q&A. So hopefully take about 20 minutes or so here getting through the content. Any questions you have, feel free to drop it into the chat. And we can talk about that, answer those as we go. So to start, key information to get from your medical provider. This is important. A lot of people are navigating this process on their own without actually understanding what's going on, right? How do we create a solution when we don't actually know what the problem is? This is an issue, right? So we need to understand, what is the actual diagnosis? Do we need to see a doctor? Do we need to see a PT? Do we need to see an athletic trainer? Do we need to see someone to get a proper diagnosis first, understand very clearly what is going on? This is a very important first step. In addition to that, right, not just a diagnosis, right, because we have things now like shoulder impingement, patellofemoral pain. There's so many different things. We throw plantar fasciitis at a lot of things these days, not understanding just solely what that diagnosis is, but what tissues are affected and what is the actual injury itself, right? Does this have to deal with a muscle, a tendon, a bone, bursa, nerve, disc, right? There are a lot of different tissues throughout the body that can be injured. What is the actual tissue? And then what is the injury? So when I say what is the type of injury, that means, is it a tendonitis or a tendinopathy? Is it bursitis? Is it nerve entrapment or radiculopathy, right? There's a lot of different things that could actually give us somewhat similar symptoms in some way. So making sure we understand exactly what tissue is affected, what is the type of injury, that's what we need from the beginning. A lot of people say, hey, my knee is hurt, I'm just going to rest for a few weeks and then get back at it. Okay, what structure? How long does that take to heal? When can I actually return to run? What do I need to do in the meantime to make sure I can do this safely? These are important things to understand on the front end. And then what is the reason for injury? A lot of times we have these diagnoses, but we don't understand why they happened in the first place. Was this based on a training error? Did you increase your volume? Did you increase your speed? Did you change your terrain? Did you change something within your training program abruptly that predisposed you to this injury, right? So really reflecting back on the couple months maybe before your injury and seeing, okay, why did this happen? Because if this happened because you made a training error, you probably shouldn't make that in the future, right? We need to understand and learn from these things so we can move on properly and not make the same mistake twice, or we can structure our training program in a slightly different way. So when we get to that phase of our training, we're better prepared to handle that, whatever that is, the demands of the training. Is it based on some type of deficit? So limited range of motion, strength, stability, neuromuscular control, running form, right? Is there some kind of deficit from a biomechanics standpoint with your body? Is it weakness and differences in strength from side to side, right? There's certain things that we need to look at through the evaluation process to understand the why, right? A diagnosis tells us what tissue is injured and a name for that injury. However, why did we suffer from this? Is this something we actually need to address throughout the rehabilitation process to make sure we do not suffer from this again? And then incomplete rehabilitation is important to understand because once we suffer from an injury once, the chance of us suffering from that injury again is very likely. So we need to make sure we go through the proper rehab process, the full rehab process, to get better and to resolve the injury so we don't continue to suffer from the same injury in the past. You'd be surprised at how many people I work with that finally find me in some way, whether it's me, again, relocating over the years or through social media or what have you, that say, hey, I've been dealing with plantar fasciitis on and off for the last 10 years, or Achilles or a patellar tendon or what have you, right? Some of these things can linger quite a long time if we're not properly rehabilitating the first time and going through the entire rehab process. We don't want to stop when you're pain-free, right? That's the first step. Resolving pain is step number one. How do we actually completely rehab this injury to restore the tissue itself to function the way it should? This can sometimes take months to even years in some cases, depending on the severity of the injury. And then lastly, from the medical provider, really making sure you're outlining an accurate timeline for healing and return to running. This keeps runners in this cycle, right? If we don't understand what the diagnosis is, what tissue, what type of injury it is, why it happened, how do we then lay out a proper rehab program or return to run program if we don't have a timeline in place? So most people that know that work with me come from an injury. If I see them for the first time, I do an evaluation, I digest everything, I send them an email. Hey, based on the evaluation and the stuff we talked about, I foresee this taking you 2 to 3 months. I foresee this taking you 6 to 12 months, right? I throw that out to some people at some point if they've been dealing with things for years, because they need to understand how long it's going to take to actually properly heal that tissue and restore it back to its proper level. That's also important from a psychological standpoint. I see a lot of people that, oh, my doctor just told me just rest for 2 weeks, then get back at it. But we're dealing with an injury that's going to take weeks or months to actually properly heal. We get back and run after the pain goes away. We re-injure, but we didn't actually give the tissue, give the injury what it needs to get past fully. So understanding and really outlining an accurate timeline so you can return to running the right way at the right time and see the success you deserve moving forward. Now, when it comes to the rehab process, really what we're trying to do here is bridge the gap from pain to return to sport. So first goal is always, can we reduce pain, right? We want to eliminate pain or reduce it significantly so this person's not compensating, they're not having issues throughout their daily routine. They can start to restore capacity of that tissue to get back to the things they love to do. In addition, we want to increase range of motion, strength, regain functional capacity. So what that means is just the ability to do the things you love without issue or limitation, whether that's could be gardening, could be just going out, you're going through your daily routine up and down stairs, could be running. There's a whole different thing, whole list of things it could be, but just allowing that person to function at their best without repercussions from being active. And then obviously we want to address the factors, right, that predispose this person to injury. So like I mentioned before, are there certain deficits? Are there biomechanical issues that we need to address? Because if you just rest, you allow that injury to calm down, you don't do anything to address it, and there are some kind of biomechanical factors in there that predispose you to that, you're not actually addressing the root cause of the problem. You're allowing pain to go away, usually because you're not stressing that tissue anymore. That's going to happen over a period of time. And then you're getting back to it, but then you go through that cycle again, just because you didn't do anything to actually address the cause. So making sure you address the cause, and then you're actually preparing yourself for the demands of running. we know running very well at this point. So there's still a lot we need to learn, obviously, just like everything else. But we know running is a single leg sport. Every time you strike the ground, 2 to 6 times your body weight is coming down on a single limb. Stability, balance, strength, neuromuscular control, power, right? All of these things are required to run. So we need to make sure throughout our rehab process, we're not just focusing on reducing pain and then back to running. We're transitioning and taking these really smart steps, one step at a time, to prepare ourselves for those demands. Because if we rehab over that usually 1 to 3 month time period, but we don't actually get back to jumping, to landing, to being powerful and stable, there's going to be issues once we start back up. So we need to make sure we transition properly and we're actually ready for the demands of running. From a fitness standpoint, as soon as people can get moving in some way or find an alternative form of cardio, I recommend it, right? So I always recommend people strength train. If you're dealing with a lower body injury, can we still do core? Can we still do upper body? If it's a knee injury, can I strengthen my calves? Can I strengthen my hips as I lay on the ground that doesn't stress the knee? Right? There's a lot of ways around this, but we need to make sure we're doing a good job staying active as much as possible, continuing to move, because there's a lot you can benefit from throughout this process rather than sitting back, resting, and only rehabbing that injury. How do we improve the strength, improve the power and different factors there of these other tissues? So when we get back to running, we're actually a step ahead in the process. It doesn't mean we're always going to end up down here. We can do little things throughout this process to actually come out ahead and to learn from. So making sure you do that, but we need to respect the tissue that's healing, right? So if it's an Achilles issue, we obviously want to stay away from something that's going to really load the Achilles. Maybe for some reason, biking irritates it. So we try something else. We do a upper body ergometer, right? We're using the hands, that upper body bike. Instead of that, we can still maintain or improve cardiovascular fitness. So finding some type of alternative as soon as possible is good, especially for runners who tend to take injuries in the rehab process it's very challenging, right? Psychologically. So continuing to be active in some way for very goal-oriented people is important. What we need to make sure of is we're establishing different phases throughout this process and actually having strategic checkpoints. So what I mean by that is it's almost like a video game, right? If we want to win the video game, we have to complete and win every single level 1 to level 10. There are certain things we need to do in every single level to make it to the next one, whether it's points, whether it's last a certain amount of time. There are certain things that we need to accomplish to make it to the next phase or the next level. It's the same thing with the rehab process, right? So we start in the beginning with our evaluation process, right? This is step 1. We understand the nature of the injury, and then we find out through the medical provider, are we actually cleared to load the affected tissue? Right? Can we start training on this tissue? Does that mean, do we need to offload it temporarily because it's some type of bone stress injury? Is it a tendinopathy? We actually want to load that quickly to a certain degree because that's going to help me get through the process. So understanding where we are and when it's proper to get started rather than just resting for a week and going, right? Getting that diagnosis, understanding what the injury is, and then knowing when the right point to load that is very important. As you get into the rehab process and you're actually clear to start loading the injury in some way, primary goals are just to reduce pain first and foremost and progressively load the tissue. If we start progressively loading the tissue or strengthening and addressing that in some way, but we're still having pain, right? Is that tissue actually going to be more functional if every time I do something on it is painful? So usually pain is one of our first priorities throughout this process. Can we get this person just to reduce pain so we can start to move, so we can start to load, so we can start to train in some way? As you go through that rehab process, I actually break this down for people based on the injury. So I have some, and because running is such a single leg sport, that's the end goal I want them to get to. Single leg jumping, right? That's what I want them to get to. When I know they can single leg jump, hop for 20 times in a row without pain, without any compensation, they're usually cleared to run. But in the beginning, do I start them on the ground? Do we do non-weight bearing exercises, right? To strengthen the surrounding muscles and to load that tissue without being upright? Then do I do strengthening on 2 legs? Like I might go to a squat next on 2 legs. Then maybe I'll go to a split squat, right? A stationary lunge. And then maybe I'll go to a step up. And then maybe I'll go to a single leg squat, right? We have these different checkpoints along the way that each runner should be able to accomplish. A lot of times people just throw random exercises in there. Hey, I'm going to do these different things, and there's really no rhyme or reason to it. Runners need to do a better job of proving they can run. If we're coming back from an injury, you should be able to do those little things that make up the foundation for running, right? So can you jump and land? Can you load the hip in different planes of motion because we're having to support the pelvis and support the hip? There are a lot of different things we need to be able to do before we get back to running rather than just rushing it and jumping back in. Can you fitness walk for 60 minutes without increasing symptoms? So is that just getting out there? This could be part of your supplemental training here, your cardio to some degree. As soon as people, if they can walk without compensating and with a very low level of pain, and pending it's a tendon or a muscular issue, we want to get them back to walking as soon as possible. And that actually becomes part of their program, right? So getting out there anywhere from 2 to 5 days a week, walking, being able to progress up to 60 minutes without pain, without limping or compensation. And that's when I know if they could do that, and they can clear the return to run testing, that's when we get to return to run. You can see on the right side of the screen here, there are a couple of different exercise pictures. So on the top there, she's doing kind of like a step up or a step down. On the bottom, it's kind of the hip hinge to single leg jump. These are some of the things that I have runners do before they're allowed to run. They need to prove they can run. Rather than having an arbitrary timeline, like, hey, 2 months until you can run again. And then people sit around, they wait, okay, I'm feeling better, I'm going to run. You have to prove it, you have to earn it. These are the little things we do just to make sure everything is good. If we run into this, we do this exercise, do this drill, and there's pain, hey, we just need to take a little bit longer. You're not ready yet. I had a woman a couple of weeks ago, I've been working with for a while, had a fracture, and she was coming back and the doctor said, hey, you're good to run now. The PT said you're good to run now. She came to me, and I'm very objective. Like, you need to prove to me you can run before we do this. So we're not going to risk anything and have you set back if there's going to be issues. So I said, all right, if you can do these 5 things, you can run. We'll start the run walk program. Come to find out, like, through her physical therapy, she wasn't doing anything on a single leg yet. Haven't been any jumping. There was not even a single leg calf raise. As soon as she started the return to run testing, she immediately said, I'm not ready. Right? She knew there was no way that she could take that step from where she was to where she wanted to be yet. So we extended her timeline. We said, okay, here, right now, you're at this point. We need you to get to here. These are the things that we need to do over the next 6 to 8 weeks to get you there. We kind of laid that out in a more objective way rather than, all right, well, you're not ready yet. Let's keep doing this and see where you are in a week or so. No, we laid things out based on how the body responded. So now we take out the whole emotional side of things, right? Because we all want to get back and run. It's hard when we take that part away. It's part of our identity. So now she understands, hey, I need to do these things. I know where I am. I know where I need to get to. I know where I need to be. I have this roadmap along the way, and it's a little bit more uplifting and positive, right? So having these strategic checkpoints is smart and helpful to a lot of runners. And then from there, once we can actually run, get into the return to run program. So initially we want to do run walk intervals, and I'll kind of run you through this here in a second. Run walk intervals is the smartest way to do it. We already know we can fitness walk for 60 minutes, right? Walk at a brisk speed. We've done our return to run testing, so I can load that tissue without any repercussions or pain or any issues. So now I start that run walk progression, and my goal over time is to progress from a run walk interval to steady running. Once I get to steady running, then I get to unrestricted running, hopefully in a period of time. This return to run walk program, typically what I run most people through, takes about 2 months. That's how strategic we are in progressing back through. Longer than a lot of people want, but as they get to the point where they're going from run walk to graduate to steady running, there's no uncertainty at that point. There's minimal to no pain. They are confident in what they're doing. They easily transition to the next step because they're proving it every step of the way. They're ready to handle those demands of running rather than just throwing someone in aimlessly. Let me just check here. I realized I clicked off my buttons, and now I can't. Let me just fix something 1 second, guys. There we go. Sorry if you might see a panel floating around on the screen. So outlining a structured and progressive return to run program. So now as we do this, this is where we need to be smart and strategic. Do not plug right back in. So what that means is if you were injured and you took some time off, you rehabbed or you rested, a lot of people just get back to it, right? There's no rhyme or reason. There's no thought process behind it. They just go back out and they run. I'm going to see how I can do today. Things are feeling good. These are the people that are typically consistently in the cycle of having issues. We need to figure out where your body should be in terms of the amount of load and stress it can handle. And we put you in at that point. If you've been off for extended period of time, we start at level 1. We start slow and we build up, right? A lot of people that I deal with that have muscle or tendon issues, we don't necessarily have to start at level 1. We can start somewhere else in the process, but we need to understand that throughout the evaluation process to see what that person's ready for. We never throw them in the deep end and hope they can swim, right? We always put the floaties on first and the life jacket. And then from there, we start to peel those layers away one step at a time. You can see here on the left side, these are different return to run programs. There's no perfect way to do it. As they say in the research, right? Return to running is an art and a science. So we have some research that's going to back this up. But also it just depends on the person. You really need to be creative to understand where this person is, what they can handle, and then walk them through the right program for them. So on the top, we have a program from Chris Johnson. This is kind of what I follow for most people in some way. And the bottom, this is an Ohio State University hospital or medical center program. You can see the two different ones there, getting people through intervals first, and then getting them to a steady run progression second. Biggest thing as you go through these progressions is this is your strategic checkpoints, right? Level 1, can I run for 1 minute, walk for 10 times, which is 40 minutes of total training time, we'll call that. Can I do that with a rest day in between? Can I do that 2 times in a row before I move on to level 2? As long as no significant increase in pain, no issues, no compensation, limping or what have you, that's when we move on to the next step. So every time you complete a run, I ask people, this is what I write underneath, like in their training program, any pain, rated on a scale of 0 to 10, where was it? Any compensation or limping, any issues that you want to note outside of those areas, right? Every time they run, we communicate on what that is. And then we decide, okay, are they ready to move on? If they are, okay, level 2, 2 minutes on, 2 minutes off, times 10 for 40 minutes again. And then we continue to walk down these levels from 1 to 10 until you can see level 10 is 45 minutes of consistent running. So that's what we do. We make sure we have a smart and progressive plan that takes them from where they are of doing no running back to 45 minutes of consistent, steady running. But the rules are in place. Pain depends on the injury, right? If it's a bone related injury, 0 pain, right? Sometimes it's going to be soreness. There's going to be something felt in awareness at that bone site, typically as you load it and it gets stronger. That's typical for the human body, but there should be no pain. A muscle or tendon issue, we usually are a little bit more lenient when it comes to pain. We want pain to be anywhere with this Chris Johnson program, I think his limit is 4 or 5 out of 10. If pain increases to a 4 out of 5 out of 10, it goes away within 24 hours. Technically, that's stable pain. That's okay to continue to train through. But this goes back to understanding what your injury is. Is it a bone? Is it a muscle? Is it a tendon? Is it a nerve? Is it a disc? Is it a bursa? Right? If you do not know what the injury is, how do you walk through this process? Bone, there's no pain. Muscle and tendon, there can be low-level pain. So we need to understand from the beginning what the injury is before we go through this program, or we don't have any principles to follow, right? We don't run 2 days in a row initially. We get through this program with rest days in between. We can do some other lower impact type cardio if you want. It could be elliptical, it could be bike, it could be maybe some strength training in there in between days if we're smart. But we make sure we have some recovery time in between just to see how we respond. From a principle standpoint, like I'm kind of talking about now, our goal is to eliminate the subjectivity and let principles guide the decision-making. So runners, when injured, are very emotional, right? It's hard to go through this process in a very objective manner. So that's why the principles decide, they dictate everything for us, right? It's black and white. There's no emotion. There's no, oh no, that only happened because I was on my feet more the night before and I was doing this. I don't care, right? Your pain hit this point. You're supposed to stay under that. We're not going up. We're going to stay at this level. We're going to take a step back, right? It's very objective. So pain parameters is very important, right? Understanding what the injury is, how much you can irritate that injury without being set back. FDI principle, this is one of my most important, and the biggest thing I follow, especially when creating running plans, is we always focus on frequency first. So can we get back to running more days per week? Right? A lot of people get into trouble because, hey, I'm running 2 days a week now and I'm going to start running faster. I'm going to go to the track. we're not running enough to handle higher intensities, to handle changes in terrain, right? So we want to run more days per week first. We want to run low mileage with a big base. So can I run 3 to 5 days per week? Okay, once I can run 3 to 5 days per week, then I'm going to add volume or add mileage. So I'm going to build up maybe on Wednesday and Saturday. I'm going to build up mileage of those days. I'm going to make them longer running days that it eventually starts to mold into a more specific running plan. And then once I get to a certain point, that's when I go into intensity, right? I'm running, I'm hitting the number of days per week that I want to run. I'm hitting a very moderate mileage, right? I'm not just running 5 miles a week. It really depends on what your end goals are, but I have a good foundation in place first. Then I start adding in pace. So now I start running faster. Do I change the terrain? Do I add hills? Do I do tempos? Do I get on the track? That's always the third step. People sabotage themselves regularly because they're trying to go to intensity first. Hey, I'm back to running. I've been running for 2 weeks. This is boring running slow, so I'm going to run faster in some way. That's running self-sabotage right there. That's where everyone gets into trouble, and where I fight people on a regular basis. Run slow, continue to run slow, build a big aerobic engine, allow that tissue to become stronger, to build endurance, to be better tolerant to the demands of running. And then you start adding in these other things. If you rush those, that's when you're always set back. Faster running changes the terrain, require more stability, require more range of motion. Muscles, joints have to absorb more load. So it's a more stressful way to run as we start adding in faster speeds. So that's why we always go there last. Allow adequate recovery between runs. So we want to have a rest day initially. At some point, we need to get to back-to-back days. Now that's usually once we get past that 8-week return to run program. Then we start stacking 2 days, probably two short days, a medium and a short day, right? We start to be strategic on how we're putting these things back to back, because we're not allowing the body to recover as much. We need to be ready for that. But initially want to allow adequate recovery between runs, just to understand, to have that checkpoint in there. It's the same thing as the run walk interval, right? As we run, we're stressing to a greater degree. As we walk, yes, we're still training for a fitness standpoint. We're getting out, we're loading that area, but it's given us a period of time where we can be aware, okay, how do I feel right now? Am I continuing on? Are there any issues, right? It gives us a checkpoint to allow us to see how we're doing. And then our goal is always to go from a run walk to steady running. Again, a lot of people just jump back in, but can we add some kind of run walk in there to have that checkpoint to see how I'm doing, and then to progress that over a period of time. Now, take home message today, and we'll start to wrap up. So if you have any questions, feel free to drop them. First and foremost, be accurately diagnosed. Today, I didn't go into specific injuries. So you might be dealing with something, and it's always hard to really talk in depth about that on a general webinar. But biggest thing you want to understand from the beginning, is it bone or soft tissue? This is very different. Bone, you're going to be shut down for a period of time initially as that bone calms down, as it starts to heal. Soft tissue, you usually can start to load a little bit more quickly, right? If it's your, it could be everything. Is it your glute medius, or is it a femoral neck stress fracture, right? Could technically be in the same area of the body, a very similar location, pain presentation in some way. But we need to understand, is this a bone stress injury or is it a soft tissue injury? If you are unsure what it is, I wouldn't keep pushing through that, right? There's a lot on the line there that it's gonna sideline you quite a bit if it becomes a bone injury. You could be resting from anywhere from 2 to 12 weeks, right? Or longer. It could be on crutches and non-weight bearing, could be partial weight bearing, full weight bearing with no running or no impact. Soft tissue injuries, usually we can manage those a lot easier. You need to be smart about. We can't just do anything. But usually there's less restrictions there if you're following the proper rehab program. Rest as a standalone is not a sufficient strategy, right? What is the reason for the injury? Just resting something, we might not actually be touching or addressing the underlying issue. Is there some kind of deficit, biomechanics issue? Is there something that we need to treat in the process here throughout the rehab process to make sure you're not just sitting around resting until things are pain-free? You're doing something in that process to address strength, to address fitness, to address the injury, and then you're progressing back into running. Importantly, who's your support system? So running injuries, and the more I see these over the year, just as challenging psychologically as they are physically, right? This for a lot of people is their identity, right? As we get older and we grow up and where these are our inner circles of our friends and what we do on the weekends. And we spend a lot of time here. So this is our identity for most people. So understanding who is there to support you, whether it's a husband, wife, family member, is it a PT, AT, is it a psychologist? Like, in my opinion, most people need to talk to someone to get through some of these, especially these more extensive injuries. And there's no shame in that, right? They're hard to get through mentally as much as they are physically. So helping you navigate that process, I think is very helpful. And hopefully we're there to help others and be empathetic as much as possible, because it's a big hit to a lot of people. So just try to be there and support someone as best you can. So it's hard to be the one that's sitting there on the weekend watching all your friends post pictures and all this of completing races and doing that. So get a good support system, because I think that's a big piece of this as well that we tend to neglect because we think it's all physical. You can see a lot of things are shifting these days that we really need to take care of ourselves up here. Now, injuries are challenging moments which will define your running forever. The chance of re-injury is high, right? If you injured something, the chance of you re-injuring that same area is very likely. So are you doing the things from the beginning? The people that I see typically that are coming back, hey, I've had this issue off and on for 10 years. They're neglecting this initial starting point. They're not completely rehabbing, they're resting, getting to a point where things feel better, and then they're plugging back in. And sometimes, hey, that works great for weeks or months or sometimes even years. And then it comes back, right? So making sure you're doing the little things so you don't have these persistent nagging injuries, because they tend to plague a lot of people with the high injury rates of running. So do the small things in the beginning, be patient, walk through the entire process, get a support system, get people in there that know what's going on, that will support you the right way, that will slow you down when needed, or will also push you like, all right, you can do this, keep moving forward. Make sure you have those people there. So if you guys have any questions, feel free to drop them. I actually, there were a few in the sign up here. I'm going to ramble through really quickly. I know it took a couple extra minutes, longer than I wanted to for you guys, but I'm going to answer a couple of these questions here. So question, how to help my daughter get back mentally as well as physically. That's just huge, depending on the injury, especially the severity of injury. Daughter, again, if we're talking about a younger athlete, high school, college, especially, I mean, this is an identity, right? This is part of it was for me, at least, going through high school sports, right? To be this sport player, right? And everyone thinks of you as that person. So I think the whole process putting yourself in the right position to be successful. So understanding what is the injury, what is the issue, how long does it actually take? I think a lot of times we are very unaware of those things. We don't have a clear understanding of actually what's going on. And then we consistently think, hey, maybe next week I can try, maybe next week I can try. And then eventually that just wears you down. So having clear expectations based on the injury itself is very important. And obviously if the person needs to be seen, right? School counselor, psychologist, social worker, or whatever it is, just to talk through these things, right? Sports psychology is huge and very important, because even as we get back from that injury, right, that fear of re-injury and that the whole mental aspect of that might still be there. So being seen, talking through the key things, I think can be important for a lot of people. So Beth asked, will making the muscles even stronger with strength training keep re-injuring at bay, or is it a combo of strength and cardio? So it's a million different things, to be honest with you. It's not making the same mistake twice, right? Is there some type of error within the training program? Did I progress my training program too quickly? Did I increase speed or increase volume quicker than my body could handle? Some people, there are things going on that it's just that's the last straw, right, of training, because we all have those little underlying things in some way. That's the aging process. Strength training and, again, cardio, proper running, all that stuff should be helpful. Think of strength training as making the tissue stronger and more resilient to the forces of running. So if we do that, we should be able to handle those loads a little bit better to help reduce the likelihood of injury. With that being said, there's so many different variables here that it's hard to say what the one thing is, because a lot of things from nutrition to, again, stress to workload to work-life balance to, am I recovering properly? to training program, right? There's a million different things. That's why the research on running and running injuries is so challenging, because there's so many different variables to consider that we don't know exactly what it is. But strength training, rehab, returning at the proper time period, proving you are actually ready to run rather than just going out and running. I think that's the biggest thing that a lot of people need to do to check that box. Jessica asked, and this is also a good one here, isn't 10 minutes run in level 1 in week 1 cumulative to 20 minutes week 2 too aggressive? So what she's referring to right here is level 1 to level 2, right? This is only 10 minutes of running. This is 20 minutes of running. This is 30. This is 32. This is 35. This is 36. This is 42. So you can see the initial jumps are bigger and they get smaller as they go, as we get to the next level. Is that too much? It just depends on the person. Have I ever seen it be too much? No, I actually never have. As you run slow, very slow conversational pace, which should be another principle, right? Running slowly for these run walk intervals. I've never seen anyone struggle from level 1 to level 2. It doesn't mean it's not going to happen. For some people, because we're adding another 10 minutes of running for that person, maybe we change that and we add a level 1.5 in there, right? I've never needed to do that, but those are the situations. You cross those bridges when you get there, right? There's no way to know until you know. Usually it's not too much stress, in my opinion. It's not too big of a jump to create glaring issues, right? You might notice, hey, something's irritated. Okay, I'm going to stay at level 1 longer until I can really do that well before I go to level 2. But it's not too big of a jump to make. You'll be surprised at some of these other ones here. Like you look down here at this Ohio State one. Look where they start most people. Phase 1 is 4 minutes of running, 1 minute of walking, 6 minutes of running, 1 minute of walking. So you look at the differences of this program, you look at this as they get through the return to run program, their run walk program, they get here and they go from 10 miles a week to 14 to 16 to 22 to 32 to 40. Like I calculated some of this out and I was looking like, wow, that's a big percentage increase. There's been new research out lately that shows the whole 15% per week thing isn't necessarily specific to everyone. It's a kind of a general recommendation thrown out there. Some people can progress more quickly. Other people need to progress more slowly. It's really, there's no ideal way to progress the program. So that's where I think the art of this comes in, understanding the person, understanding where they're at. You can't go wrong adding a phase 1.5 in there and having people progress if they're unsure, I think. So that's the safest way to do it. Now, let's see. Thank you, Terry. Does the 10% rule apply to return to run walk progression? No, it technically doesn't. Technically, based on the new research, doesn't really apply anywhere. Everyone can be different. Some can progress more quickly, others more slowly. Generally, with the programs that I create, we're looking at, we use 15 as a general ballpark, but it really depends on the person, their goals, and how they've responded to running in the past. But yeah, these programs are laid out as they're laid out. You can see there's differences, but usually the strength training to supplement this, people that are doing other exercises to really fill the gaps. That's where you can see the benefits there of getting from one level to the next. Thanks, Terry. Thanks, Andrea. Laura, would you consider medial tibial stress syndrome bone or soft tissue? Depends. Can go either way, I think. Right? That's an area that if someone didn't get, if that person didn't get it and already get an MRI to understand, is there anything bone related like that? I wouldn't even debate, do I think it's bone or soft tissue? I would just figure it out for sure. To be honest with you, just depending on how the person responds to training as they run, does the area, again, depending on the site of the bone, we know specific locations. Is it the very front of the bone, the anterior cortex of the tibia? Is it the posterior medial edge? Because people still call that shin splints, even though it's different. But how does that area respond to training and to load? If it gets worse as the person trains, would probably shut them down immediately and say, go get an MRI, X-ray MRI, and go see what's going on. If it feels better as they continue to train and load that within, again, this, you probably should know this at this point already. It's nothing I'm saying go out and test right now, but it feels better as they go. Hey, there's a good chance it's soft tissue. Even if there's still so much overlap in that area, you're better off getting an MRI and being definitive than to continue waiting and being unsure of how to move forward. because that's where the accurate diagnosis comes in, where a lot of times you don't know, what if it's both, right? What if it is irritation? What if it is post-tib tendinopathy, but there also is a bone stress reaction going on? There could be multiple things still because it's such close proximity to the bone. So you really need to make sure. I would say at all this, like you say, one said biking fine and low pain okay. One says no biking and no pain. When in doubt, no biking, no pain. It's not worth it. And especially, I know you mentioned your daughter earlier. So we're talking about probably a high school athlete. I would probably say shut this person down more so, and then figure out what's going on before moving forward. All right, guys. So that is the last question. If you have anything else, thanks, Beth. Anything else, feel free to drop it. You guys know where to find me. I will be sending the replay tomorrow at 11 a.m. If I can bore you through this 40 minutes. Sorry about that once again, but let's get out of here. I know you guys have a lot going on. Hope you guys have a great week. Reach out anytime with questions. If anyone wants to talk through any of this stuff, and I have some of my regular clients on here, some people who I haven't met before, any question or confusion as it relates to you, let's talk about it first. Let's figure out what is the best step. Most likely, I'm going to tell you, you need to go somewhere, get evaluated, understand what's going on. If I can help you with that, I would be glad to do it. But don't guess your way through this. Figure out definitively and move forward the best way from the beginning, rather than spending weeks or months or all that being uncertain. So hope you guys have a great week. We will definitely talk soon. And as always, I appreciate you guys joining me on the webinar today. Thank you.